Hi, my name is Nicole Otto. I'm an 8th semester nursing student at Lincoln University. Today is February 2nd around 2:30, and today I'll be doing my trach suctioning and trach care video. Hi, my name is Nicole. I'm going to be your nurse today. How are you? Good. Can you tell me your name and date of birth? Awesome. I'm going to provide for privacy. I'm going to assess my patient's lungs, their breath sounds, and their work rate, and we are going to do some suctioning. Because my patient has a trach, we will always have a obturator and one size smaller cannula at bedside. So I want to make sure that's here. Here it is. I'm going to set my patient up. I'm going to put a towel. Going to turn on my oxygen to hyperoxygenate my patient, and also turn on my suction, and it would be between 80 and 120. And I want to have a form of communication. So if my patient is having difficulty breathing or is in any pain, I'm going to have their razor left hand if they need a break. So we're going to get ready to suction. I'm going to open my sterile kit away from me. And now put on my sterile gloves. And if that would fold back over, I would get a new pair, but for the sake of this video, I'm going to keep going. Now I'm going to fix this. And I'm able to move my clothes around because all of this is still sterile. I'm going to let my cups roll, and I am going to discard that into the trash can. And this sterile water came in my sterile kit. Going to get out my suction catheter, twist it around to loosen it up a little bit, and now I'm going to become non-sterile with this hand and hook it up to suctioning. Going to make sure my suctioning works and clean out the catheter and lubricate it. And now I'm going to suction. I'm going to insert 12.5 centimeters, not suctioning on my way down. I'm going to take this off with my non-sterile hand. Inserting once I'm 12.5 centimeters down, or meet resistance, I'm going to pull out an intermittent suction on my way out. And then going to put the oxygen back on my patient. I am going to suction for 10 or 15 seconds, and then I do not want to suction longer than 5 minutes. I am going to let them, I'm going to allow 30 seconds in between suctioning. I'm going to reassess their lung sounds, and I'm going to suction again. So I want to clean out my catheter. I am going to suction another time. And inserting 12.5 centimeters and suctioning on the way out. I'm going to put my oxygen back on my patient. Clean out the suction catheter. I'm going to assess my lung sounds again, and since they are better. If I were not going to do trach care, I would turn my oxygen back down, but because I'm going straight into trach care, I am going to leave the oxygen up. I'm going to turn my suctioning off. Clean up my station. I would normally throw this away. Going to open my trach care. Not going to touch that rolled up part. And I'm going to discard of this in the trash as well. Going to set up my sterile field. And if this surface was wet, I would make sure it was dry. New dressing, my new trach collar, gauze to clean, my sterile water, my hydrogen peroxide, and my cleaning brush. I'm going to put sterile water in 2 of the compartments. And I would open this hydrogen peroxide and put it in the other compartment. For the sake of video, I'm not going to make this non-sterile. Take off the oxygen and take out the cannula. I'm going to place this in the hydrogen peroxide. I'm gonna let that sit a little bit. I'm gonna look and see if there's any drainage. Pick this up with my clean hand. Take this with my dirty hand. I'm going to clean the cannula. Clean it real good. And then I'm going to place this in the normal saline. Once that's in the normal saline, I'm going to take my sterile hand, tap it off because we don't want any of that excess water going into my patient's airway. I'm sterile. And then I'm going to remove the old dressing with my non-sterile hand. I'm going to assess it for any drainage. And with my sterile hand, I'm going to clean it. I'm going to put this in the normal saline. And remaining sterile, cleaning around the drink. And I would do this with a few pieces of gauze. And then I am going to have one of my fellow colleagues come help me to hold the trach in place. I'm going to put the new gauze and also put on my new trach collar. I'm going to stay sterile while I put this on first. And towards the end, to get it all situated, I became unsterile. Doing one side at a time. head. I want to make sure it's flat. Sorry about my hands all up in your face, sir. And I do not want it to be too tight, but I don't want it too loose so it stays. I want to make sure I can fit a finger or two underneath. Thank you. And then I will clean up my area. Discard this. Put the oxygen back on my patient. I return the oxygen back to the normal level. Ask my patient if I can get them anything. And then I will go document. I will document the suctioning, how many swipes I did, the amount of drainage, and then the trach care if there was any drainage out of that either. Date and time as well.